Poor patient perception impacting finances in community hospitals. HCAHPS, Hospital Consumer Assessment of Healthcare Providers and Systems, have changed the way that hospitals get paid. Our world is one of increasing transparency. We find that hospitals often struggle more with the patient perception components of HCAHPS than with the actual clinical care components. The range of questions that patients are asked are broad. Some facilities may score well on communication by physicians and nurses, yet fall short on how clean and quiet the hospital environment is. Others do well communicating information related to medications and controlling pain, but fall to the bottom of the list when rated on the information they were given on discharge. Patient perception is now directly linked to reimbursement. The inability to consistently control patients' perception has become an Achilles heel for many community hospitals. In our experience in working inside and outside healthcare organizations, it's clear that there are some areas that lead directly to poor patient perception. These include clinically exceptional staff who are promoted to supervisory and leadership positions without the specific attitude, skills, and knowledge to lead others. The inability of those same managers to engage and align employees with the organization's overall goals, and poor communication throughout the organization. The best performing hospitals have successful managers who engage their employees, which results in an overall improvement of their patients' perceptions. We have seen repeatedly that successful managers are those who are highly skilled at influencing others. They help their employees understand how important they are to the organization and believe they cannot over-communicate. Successful leaders work with people who do what the leaders need them to get done because it is exactly what they want and know that they will benefit from it. More specifically, here's what successful managers know and what they do. They realize that empathy is a skill that can be developed and are driven to develop these skills, increasing the likelihood they will understand others and how they feel when they do what they do. They then use the skill to understand their employees. Next, they value good communication. They understand how hard it is to communicate accurately, concisely, and work consistently to improve communication. They know that it's important to mirror other styles in order to improve communication. The best managers know about their employees' lives. They don't pry or push, but rather they interact with them in a variety of situations and actively listen when they offer information. Successful leaders then are able to follow up with appropriate questions or express appropriate concern. They also learn what is motivating to their employees and colleagues. They recognize which things in the environment bring out the best for each individual. Successful leaders understand behavioral styles of those around them. They understand that when people more successfully interact, work improves. Those who are the best at engaging their employees and coworkers also appreciate the value of combining the knowledge of strengths and motivators with an understanding of behavioral styles to propel results even higher. They individually consider each of those working with and around them, allowing them to work as much as possible on projects that require their strengths, and then shape the environment to support each individual's motivations. When employee engagement improves, so do the interactions with your patients. Employees become in tune with the patients, which ultimately improves the patient's experience. As their perception of their time in your hospital improves, your HCAHPS scores will also improve. Those who are successful at engaging their employees are decisive and have excellent communication skills. There are a number of profiles available that allow you to measure your capacities relative to these traits. We've used many of them and have identified and recommend one that is particularly relevant to healthcare. If you are a healthcare leader and you're interested in your own level of decisiveness and communication and how you can maximize these traits, click here to take a free copy of the profile that we recommend.